Hi everyone, thanks for watching. So the purpose of today's video is going to be to demystify therapy and have your questions answered before you start therapy or if you're currently enrolled with a therapist. Hopefully the answer to these questions will be helpful for you, and if you have any questions after, feel free to ask. But with that being said, without further ado, we'll get started. So first I'll introduce Unmute. So Unmute is a therapy matching service that matches therapy seekers with therapists with the goal of creating strong bonds and reaching more specifically to marginalized communities and individuals who do not receive the direct outreach or the services that they should in terms of mental health services. My role at Unmute is a TheraBuddy. I help match seekers to therapists, take in their requirements, their needs, and find therapists in their area that work best for them. Introduction on Rhiannon, our guest today. She is a licensed mental health counselor in training who will be answering your questions today about therapy. I'll let her take over to introduce herself.
Hello, everybody. My name is Rhiannon, she, her. As Patricia mentioned, I am currently in my program to get licensed in my LMHC, licensed mental health counselor for Massachusetts. I'm currently doing my clinical internship and I am excited to be here. So thank you.
I'm excited to have you. Okay, so I will begin with the first question, pretty basic. What should I expect on my first session with a therapist?
Yes. So your first session is going to be a little different from the follow-up sessions that you have. Depending on who you go with, you may have had an intake session. If you're in a group practice, you may have had one with an intake coordinator, or this may be the very first time that you're sitting in and having a session with somebody. Either way, what's going to happen in that first session is that there's going to be a lot of information collecting. If you haven't already, you're going to go over any paperwork you have to fill out, discuss confidentiality and the limits of that. And then the therapist's job really at that point is to start to learn to understand you, to figure out who you are, why you're coming in, why you're looking for therapy, and just kind of get a little bit of a scene of your background. And some things that would be really helpful to bring to the table in those first days would be anything like your goals. Like, what are you hoping to get out of therapy? Is this something where, you have a chronic need and so you feel like you're going to be in therapy for a while? Do you have a particular situation that you just need help working through? And, just kind of share with the therapist what you're looking for from them, what kind of support you're looking for. If you want them to be more active in the guiding process, or if you just really need someone to listen to. Those are all really helpful pieces of information to give to your therapist at the start. And of course, they can always change over time as new things come up or as you work through new stuff. But at this very early point, share what you're comfortable sharing. Ask any questions that you might have about them or about the process. And use that just kind of as the jumping off point. You likely won't get into really heavy work on the first session, but you're really just kind of establishing a baseline and getting to know each other.
Yeah, just getting comfortable with each other, right?
Yeah.
Okay. Going off of that, is it okay to ask your therapist personal questions? If I was going to therapy for my relationship, is it okay for me to ask if they are in a relationship, if they're married, or if they've been through this or that?
So you can always ask. The therapist may not answer.
Okay.
And that is because, ethically, we do kind of have a standard we have to keep ourselves to. And because of that, we really do kind of have to limit our self-disclosure. There are things that we can talk about, things that are easy to talk about. I wear my wedding rings in session, so, people will know that I'm married, things like that is fine. Generally, if you are asking about that in the sense of, I really need somebody who can empathize with me, who's kind of had that, generally most therapists are okay answering those questions. Some really do prefer to be kind of more like clinical, like, you don't really know about me, the person. But increasingly people are realizing that it's okay to share some of that stuff. Generally, what we don't share would be our own mental health diagnoses or problems we've had in the past, or, you know, things that would be triggering for us or anything that we've had in the past, because, you know, we don't want to stifle you from talking about something because you think it will upset us. A lot of times, you know, if there is something that is hard for us, you know, that's where we go to supervision, and that's where we, you know, go to case consultation with other professionals so that we can handle ourselves and you can get the help you need without worrying about us.
That's actually really helpful.
Mhm.
Going off of that, is it okay to ask a therapist what their ethnicity is?
Um, Generally, if you are doing it for the sake of, again, trying to have somebody who has lived experience with what you've lived through, that's all right. And a lot of times, people actually advertise that on their website or on their profile. They'll kind of give an update on their background. But, you know, generally, I would say, like, if you're white and you're asking someone who looks like a therapist of color, if you're like, oh, where are you from? Like,
Yeah, no.
you know, that's a little different. That's not quite it. But if you are looking for someone who you can relate to culturally, you know, let them know that, you know, you can say, you know, um, you know, I come from Tibet, and I would like somebody who understands the Tibetan independence, you know, and all of that stuff. Are, you know, are you Tibetan? Do you have Tibetan background? You know, something like that is totally acceptable.
Awesome. Yeah, and I can speak to that as well as a therapy. Finding therapists online, and people usually have preferences
Mhm.
for what communities they want their therapist to serve, and they usually have that along with like languages they speak
Mhm.
and like backgrounds that they support and everything. So I feel
Yeah.
like that's usually pretty open information that they are willing to give.
Yeah. Religion's another one. Like, there are people who talk about, like, I do Christian counseling, or, you know, I specifically work with Jewish populations, you know, anything like that. A lot of those things they do also advertise, which can be helpful also in other ways. If, you know, if you are uncomfortable with a Christian counselor, then you know to screen them out.
That makes sense. So speaking of being uncomfortable with a counselor,
Yeah.
how do you politely break up with a therapist if you feel like they're not a good fit for you?
Yeah. So this can be a really hard thing because, you know, a lot of times we want to please everyone. And so we feel bad if this person's trying to help us. The first thing to recognize is that therapists are used to having clients, you know, go elsewhere. Um, you know, the big thing is that this is about fit. It's about, you know, getting the help you need. Um, if there is a situation where you think, you know, I just can't work with this person. We're not hitting off. We're not doing, it's not going right. And you've given it a few sessions. The best way to approach it really would be to say, you know, hey, I'm not really getting what I'm hoping to get out of these sessions. I was wondering if you could refer me to a colleague or refer me to somebody else who you think might have a little more focus on XYZ. um, that's, you know, that can be very helpful because it gives them a direction for how to best help you.
Mm.
The worst thing you can do is ghost someone.
Yeah.
um, don't ghost your therapist. I know it can be really, like, anxiety inducing to have that conversation, but when you just vanish, then you stay on our client list, and we kind of have to reach out to you because we need to check that, like, something bad hasn't happened to you.
Yeah, that makes sense.
Yeah, so the best thing you can do is just come, be honest. You know, you could say something like, listen, I really think I need someone who specializes in OCD. And if the therapist doesn't specialize in OCD, then, you know, they'll be like, yeah, totally understood. You know, they shouldn't be lying about their qualifications. And if they're lying about their qualifications, you should probably break up with them anyway. But yeah, just keep it honest, keep it open. And yeah, if you can get a referral somewhere else or point in another direction, then definitely try for that.
Perfect. So if I did break up with a therapist and I'm looking to find one that is the right fit for me, what should I be looking for, and how do I know that I found the right therapist that fits my needs?
Well, you go to unmute. No. So, when you meet up with a therapist for the first time, whether it's a phone consultation or your session, whatever it is, there's, kind of a gut feeling to it. There are a few things that you need to feel, off the bat, and this changes for everybody. Some people want to just really feel validated and listened to. Some people want to feel like they have an agenda now to work towards. Really, the best thing you can do is try to take inventory, even if you don't physically write it out, just like take inventory of what your priorities are, of what kind of person you want to talk to, what the feeling in your therapy session you want to be. And then when you go into that first session, and I would say I would always say give it at least 3 sessions before you make a decision. But in those first 3 sessions, give yourself time to think like, am I getting that feeling I'm going for? Do I feel like I'm making progress in the right way? Am I coming out feeling like there's something happening? And that something happening may not be positive. You may come out of your 3rd session and be like, oh my God, I just broke down and cried for the first time over this thing. That's not a bad thing, or that's not necessarily a bad thing. A lot
Maybe
of times,
uncomfortable.
it may be uncomfortable, but that discomfort is how you open the therapeutic window. But yeah, look, like those are the things, figure out what you want to feel, figure out what kind of relationship you're looking for, give it a few sessions and see if you feel like that relationship is being built. And if you think that progress can be made.
Do you have like a recommended window for how many sessions you think one should allow before they're like, okay, this isn't for me, or this is for me?
Generally no fewer than 3. However, there is a caveat to that. If in one of your first 3 sessions, your therapist does something that like invalidates you, says a slur, like, misgenders you, like something like that, where like they just actively did something like either discriminatory or just like really made you uncomfortable and put you in a place where like you no longer think that you can get along with them, then you can cut ties there. You should never be forced to be with somebody who, you're worried might abuse you, take advantage of you, manipulate you, anything like that. So that's the caveat there. But generally, if things are, on the level, I would say like 3 to 5 sessions generally.
Okay, awesome. So what do you recommend someone does if they're not comfortable talking to their therapist about something or scared to open up about something?
Yeah, so there's a balance to be had in that. So on the one hand, therapy is meant to be taken at your pace. You can't improve, you can't work through what you need to in therapy if you are constantly feeling pressured into it. You need to have a safe space. So in that sense, it's totally fine to tell your therapist, hey, I'm not ready. Like, I can't do this yet. That said, we just mentioned discomfort, and you are not going to get very far in therapy if you are comfortable the entire time. If you only want to be comfortable, then pretty much you're just having a chat with somebody. You're not doing any work. And the point of therapy is not necessarily to just be upset about everything around you. It's to help you find what you can control, your inner peace, your inner health. And for that, you are going to have to sit, I call it, you have to sit with the suck sometimes.
I like that.
And if you do that, and again, there's a difference between discomfort and danger. If you ever feel like you're unsafe, like either your physical or emotional safety is at risk, if you are having like massive panic attacks every time you go into session, if you're just uncontrollably sobbing every time, like that's not discomfort. There is actually something happening that may no longer be therapeutic. If you leave every single session feeling worse than when you came in, that's once or twice that'll probably happen during the hard work, but like if that's consistent, then you might need to dial back. But again, the most important thing is always be honest with your therapist. Your therapist, you know, we don't get involved in your lives for one-on-one outpatient therapy. Obviously, this doesn't, count for like in-home stuff or whatever, but one-on-one outpatient therapy, we only know you in the context of those 45 minutes to an hour, like maybe once a week or once every other week. We have to go off your words. We don't go into your home. We don't follow you to work. We don't hang out with your friends. So we need you to be honest with us so that we can help you. And so if your honest place is, I can't talk about this right now, that's totally fine. But if your honest place is, I'm not comfortable, like I don't feel comfortable right now, but I understand it's important. So like maybe go easy on me. That's fine too. That's great. We want to know that. We want to know what boundaries should be, and helping build healthy boundaries is part of the therapy process. So communicate, communicate, communicate.
I was gonna say, it seems like a big theme is whether it's like you're breaking up with a therapist or you're trying to build a bond with them, is just being honest, which can be scary for people, but is very important.
And it really is. And I understand that. And, I'll take one little tangent to say, we as therapists understand that the relationship we make is like one of the most important parts of therapy. Without a good relationship, it doesn't matter how smart a therapist is. If you're not going to connect, it's not going to work. So, we really want to hear how it's going. We really want to know if we are helping you. Please never feel like you have to get a grade A. Like you don't have to get an A in therapy. We're here for you. And yes, there will be times where you're going to get pushed. There will be times where we're going to say things like, you seem resistant. You don't like, we're going to call you out on some of your stuff. But that's to help you think. That's to help you reflect and, work on your stuff. And as long as you're being honest with us through the process, and as long as, you're letting us know how the relationship feels and what we could maybe do to make sure you feel comfortable, then yeah, great. It's a two-way street. Give us feedback. We're happy. We're usually very happy to hear it.
Mm-hmm. I feel like it's like any other relationship. You're just going to have to build on it and work on it together.
Yes. Yes. Actually, that's a really good way to put it. The one difference being that, again, we have to keep professional distance. So we definitely do have to maintain boundaries like that. We can't go hang out with you after work, unfortunately, but as much as sometimes we want to.
So I'll ask a COVID related question. This pertains very strongly to unmute. So
yes.
Especially during the COVID pandemic, the need for online therapy heightened. Mm-hmm. And a lot of people have only known online therapy. So do you have any advice of what people who are maybe going to meet their therapist for the first time, not virtually, should expect?
Yep. So one thing to expect is depending on what state you're in and what practice you're going to, you may be required to wear your mask. So definitely make sure you know what the line there is. We, at least in my practice, we don't ask vaccination status. We're not allowed to. There's some, I don't know. The HIPAA implications are beyond me about vaccination status, but there are probably going to be safety precautions you do have to follow. COVID aside, going into a therapist's office for the first time can seem daunting. It really depends on where the therapist is practicing. Some have home offices, so some it'll be literally in their house, in like a special room in their house. Some places it'll be in a group practice where you'll be sitting in a lobby or a waiting room like any other doctor's office and get called in. Sometimes it's a private studio space. So, there's not going to be like one environment. Generally, they are less like sterile feeling or looking than like a hospital or a doctor's office. So it should be hopefully comfortable. When you go into the session, wear whatever's comfortable for you. Wear pants. I'm sorry. After we get out of COVID, you're going to need to wear bottoms in some capacity.
Your
but
pajamas.
or pajamas, whatever you're allowed out in the house in. But you don't have to dress formal. You don't have to wear, like, relax. This is for you. The offices generally aren't like too huge. They try to be kind of cozy. So let yourself take a minute, adjust to the space, adjust to the environment. Um, there may be some different reads when you're in the office now, because you're going to have that like that physical nonverbal communication going more. You're going to be able to see each other. It may get a little more uncomfortable because you're right there. You don't have your house in the backdrop. You can't just like walk away from the camera or turn it off. But take your time, ease into it. Again, let your therapist know if there was something that would make you more comfortable. We can work with you to help make the space work.
Mm-hmm. Yeah, I can imagine it's probably an issue for a lot of people, especially whether they're in therapy or not, just going back into society, yet alone like sitting in front of someone one-on-one.
Yes, 100%. There are some groups, like group therapy, that are starting up again, or that are going from virtual to in-person again. If the one-on-one is difficult, sometimes a group setting can be helpful. And then the group leader, just kind of facilitates rather than being one-on-one talking to you all the time. But I do definitely recommend, when you can move into physical as your physical and mental ability and status allow, getting in that space can be very helpful. It can really help diffuse things, especially if you're like socially anxious. It can be really nice to have a space where it's okay to be socially anxious. Nobody's going to call you on anything or judge you for like who you are. So yeah, I definitely recommend getting back, but again, ease into it, do what you need, and as always, communicate.
Awesome. So for our last question, I'll leave it kind of open-ended for you.
Mm-hmm.
What is one thing that you wish people knew about therapy, whether it's when they're looking for a therapist, or just starting with one, or have been in it for a while? Any advice you'd like to give?
Yes. So the biggest thing I want people to know about therapy is that it is not one size fits all. In America, we really kind of developed this very Eurocentric, westernized, whitewashed version of what therapy is and has to be. What psychoanalysis is, and what talking is, and what values and goals you're supposed to strive for to be happy. And unfortunately, that's really become invalidating to a lot of groups that have suffered trauma or come from marginalized communities, because they feel they're being fit into this mold of what therapy has to be. And it's not true. We are working, in the mental health community, we are really working on cultural competency, on being able to help support people from a social justice angle, really kind of examining our own privileges as therapists and working to help make a more inclusive environment. And that could be anything from like taking religious or cultural practices into account, doing something different from talk therapy. We have therapists who don't do talk therapy. They do expressive therapy, dance, movement, art, like going out, making things, building things, planting things. So find the therapy that works for you, and don't feel like you're a failure if you don't jive with one particular style of therapy. It doesn't mean that you failed at therapy. It means you didn't find the right fit. I tell everybody, you deserve to be well, and you deserve to feel in control, and you deserve to feel worthy. And if you don't feel you can do that, go find somebody who will help you get there. And that's what I have to say on that.
I think that's very true. It's very smart. I think you're right too. I feel like everyone has this idea that therapy is just like Sigmund Freud. You're laying in the therapist chair, like laying down, and someone's examining you, like you said, psychoanalyzing you. And you're right. That's not how it has to be. There's so many different areas and boxes you can choose from.
Yes, exactly. And a good therapist, no matter who it is, a good therapist will validate you, will help listen to you with empathy, will help you, identify reality from, perception, and will get you to the place that you want to be. Not everybody cares about, getting off all their meds, or, weighing a certain amount, or, not smoking, or, getting divorced or not getting divorced. Like, people's values are different, and a good therapist will align with your values and help you get what you want. And not necessarily what you want, will help you get what you need.
Yeah, that's very true. I think that's a good place to end.
Mhm.
I also, going back to what you said before, sometimes you kind of just have to sit in the suck. Things might be uncomfortable, but doesn't mean it's not working. It just means you're growing. So I think that's very true.
Exactly.
So
Judging means it's time.
I will thank you for coming. I think a lot of people will take a lot of information from what you said from this, and I think it's been super helpful. And like I said before, if anyone has any questions, feel free to reach out to anyone at Unmute, or if you're looking for a therapist, I will plug Unmute. Feel free to join our matching service. We have a great group of TheraBuddies and staff who are working hard to get you the help that you need. So we urge you to ask questions and reach out. And thanks for watching.
Thank you.